Hi, I'm Mariné Erasmus from Economics. I'm a healthcare economist there. I'll be looking at the funding of universal healthcare in South Africa and explaining that it really is a great distraction at this moment where we are in South Africa's development and specifically in the health sector as a whole. So I show that South Africa hasn't been doing great in terms of getting our people healthier. Our burden of disease has actually been increasing, and there's a number of studies and data from the World Health Organization showing us that. And we ask, how is this possible? We're actually spending quite a lot on healthcare in South Africa. We look at this healthcare spending as a percentage of GDP and show that it's around 8.5%, 9% of South Africa's GDP, which is not little. So in terms of our peer countries, we're spending enough, if you want to believe that. And also half of that, which is public spending, is actually more than some of our peer countries like Thailand is spending as a whole on healthcare. But we're just not getting the outcomes. The NHI white paper suggests that part of the problem is that we have a financing system that punishes the poor. So we look at this and how healthcare is funded in South Africa, and also show that actually the wealthy is paying almost 90%, more than 85% of all healthcare funding in South Africa. So there is also significant cross-subsidy. So what is the wealthy paying for that the poor are not getting? And we show also that there is big quality problems in the healthcare sectors, in the public sector specifically. This we see in the Office of Healthcare Standards compliance reports and many other statistics that show us how terrible the quality is in the public sector. So somehow there is significant cross-subsidy, a significant amount of money being spent on healthcare, but the people are still getting sicker, and we're not getting what we're paying for as a country. Now, one of the solutions that's being suggested is to throw more money at the problem, to fund universal healthcare in different ways. And we also look at the proposals in the white paper for that. One of these are the removal of the medical scheme tax credit. And we show that the removing of that subsidy or credit, if you will, shows that almost 2 million people, beneficiaries that are currently members of medical schemes, may be affected. Their affordability of medical schemes may be affected. So they will either drop out or buy down in some way. So in that sense, that we will then increase the burden on the state for service delivery, and it will also affect medical scheme premiums for the worse if that were to happen. But still, we're not focusing on what the real problems are. The other solution that's being suggested in terms of funding is a 2% payroll tax, as well as a 2% surcharge on taxable income, which is effectively a 4% increase in the personal income tax rate of individuals, also increasing the money for the state. But still, this doesn't get to the problem. We've just seen that there is enough money, there's enough cross-subsidy, and we argue that it actually is a structural problem, a problem of governance and management and accountability. And we see that there are actually outliers in the states, in the public sector, where these problems have been overcome, where governance and improved management and governance have led to great outcomes. We often hear the story of South Africans' world first ages ago, the heart transplant, more recently the male sexual organ transplants that we've had, 2 in South Africa, world first, and really just because teams and people have changed, and the management and leadership in those cases have changed. But at this point, we're only focusing on funding. So we argue that this is a distraction at the moment of delivering proper healthcare in South Africa via the public sector specifically, and that one should rather be focusing on the structural issues of governance and management. Even in the white paper, we have some examples. They suggest a purchaser-provider split, which is where we don't have the Department of Health providing services and paying, if you will, as it is now in one organization, but splitting those two functions, which will improve the management and accountability there. So it really is a solution that can make a difference. And I think as we move forward towards universal healthcare, it helps to consider the funding options, and it provides a point of engagement with government to understand how these things will affect the macroeconomy as a whole, and also the healthcare sector specifically. But it really isn't necessary to get more funding at this point. If we move along in terms of delivering care, we may need some more money, and we can solve those problems as we go ahead. But at this point, there are different ways of achieving the same objectives by just changing structures in the public healthcare sector. Thank you.